Since the onset of the virus in the country on 13th March, each week has progressively recorded an increasing number of infections. With the spread of the virus on an upward trajectory, the Ministry of Health is worried about the capabilities of county health facilities to handle the increasing number of infections reported daily.
As you all know, we are witnessing community spread, and county facilities therefore require to be ready to be able to contain this virus. We therefore appeal to counties to move with speed, to utilize the 5 billion Kenya shillings that has already been disbursed to them to ensure that they upgrade their health facilities in readiness of managing COVID-19 cases.
However, the statement appears to be informed by greater concerns about how government facilities will handle the rising number of infections reported daily.
Ideally, reducing the number of patients in our facilities is very important to us. Having over 874 patients in 50 hospitals is a challenge to the healthcare workers.
The targeted mass testing conducted within various parts of the city, telling of a more serious tale, the presence of asymptomatic patients, a dangerous and silent link to the virus chain.
I'd like to emphasize on the role of personal responsibility and to call on all of us to actively participate in aiming to contain the coronavirus 19 pandemic.
Of the 134 cases reported today, of which 3 were foreign nationals, the cases were spread out in 12 counties. Mombasa leading with 67 cases, Nairobi 31, Busia with 15, Machakos with 5, Taita Taveta with 4, Kilifi and Nakuru with 2 cases each, and the counties of Garissa, Murang'a, Kisumu, Uasin Gishu and Kajiado recording a case each. The Ministry of Health on Thursday released guidelines on the home-based care protocol to preempt anticipated congestion in health facilities. However, the residential setting that qualifies for home-based care include the availability of a well-ventilated room that will host the patient separately from other family members, availability of a thermometer and a person able to read and record the temperature, as well as accessibility of personal protective equipment to the patient and other household members. In the case of informal settlements where households share small spaces, the community will identify an institution that meets the recommendations suitable for providing care. However, with the majority of the cases reported being recorded in informal settlements due to the constraints of social distancing, questions arise as to how practical home-based care is in such environments. It puts on the spotlight on the intended goal of reducing congestion in government hospitals and whether it will be actualized in the end. Raquel Muigai, Citizen TV, Nairobi.